I think our journey with patient-centered care began in 2009. It was following the period where KGH had gone through some challenges and had a period of investigation and supervisorship. And it was in that time that I think there was a very clear realization that we were not doing as an organization what people were counting on us to do. The people that were counting us to do things would include the Ministry of Health, our regional partners, our staff, and I think most importantly, our patients. And we heard that in various different ways. And so the journey began with a renewal of the board. The journey began with the recruitment of new leadership to the organization, and particularly with Leslie Thompson as the Chief Executive Officer, and a process that began to ensure that the organization was really focused and looking at performance improvement on many levels. We began part of that with what we call the interprofessional collaborative practice model. And this was a project that began when we were working through our financial recovery with the lens that we wanted to ensure, as we achieved the financial recovery, that we ensured that the quality of patient care, the safety of patients, and the work environment for staff were not compromised as we achieved that recovery. And more importantly, where possible, that we improved it. So I think that was the journey. As we worked through the model of care redesign, we were working with the notion of how do we put the patient at the center of everything we did. And I think we were very good at looking at what we were doing for patients and what we were doing to patients and how that might be improved. But as we proceeded through that process, I think the shift was that we moved to how do we work with the patients to be sure that the redesigns were actually going to be improving their experience and their care, and we're going to be keeping them safe. We first made the connection with the Medical College of Georgia when the project leads for the model of care redesign and the patient-centered initiative attended a conference in Texas, and they heard representatives speaking there. And they learned that this was an organization that was much further along in the journey, and that they were just so passionate and enthusiastic and saw the value. So we connected with them to learn a little bit more about what they were doing. We'd already started the work, but we believed that they were going to be an expert resource to us in helping us further things along. And so we had that connection with them. And in hearing Barbara and coupling that with the Medical College of Georgia context, I think the takeaway lesson that we had is you just get doing it. It is meaningfully partnering with the patients. It's not doing for and not doing to, it's working with. And that means bringing in advisors and getting them involved in many different activities. And so those were the lessons that we took away. And we've continued those relationships. We brought the Medical College of Georgia team up about a year after we began our work to have them take a look at our organization and hear what we were doing and give us some best advice. And then we were deliberate in trying to create audiences for them so that our staff and people in our community could hear about what they were doing. So in the course of a day, about 400 people heard their presentations. And it really was, I believe, like a watershed where it became more understandable. People further down the road were able to speak with real enthusiasm about the value and about the difference it made. And I think that really helped the organization say, okay, this is what we're talking about. Now how do we support it? And we've just continued to grow from that point. The strategy process began with the recruitment of Leslie Thompson, and she went through a 100-day consultation process where she spoke very directly with many staff within the organization to hear what it is that they thought worked well and what needed to be recognized, and also what needed to change. And through that process, there were 5 areas of focus. So within 100 days, the organization was able to say, these are the things that at this point in time we're going to focus on, and where we would be looking at what are the measures that we will watch to be sure that we are having a positive impact. As we sort of carried on with that focus, the board and Leslie and the executive team and communications worked on an engagement process. That was a very broad engagement process, again, within the organization and also outside of the organization. And the end result was over 2,000 people had input around the areas of focus, and to say what was it that they were counting on us for, and what would that look like if it were to be successfully delivered. And that, and all of those sessions were recorded, so people were videotaped, and the feedback was documented. So when the process of synthesis occurred, there was ability to use all of that information, and when the directions were being developed, we were able to present those, validate them, and then show how they were connecting back to what people had told us during the engagement process. And that ultimately led to the launch of the KGH'S Strategy 2015, which has 4 very specific strategic directions and 6 enablers. And that strategy carries with it a 5-year plan where each year there are very clear milestones that are expected and indicators that we can monitor on an ongoing basis that tell us, are we achieving what we are expecting to? If we're not, what's the understanding of why not, and what are the actions that we can take to move differently? And if we are, then also how do we celebrate the accomplishments with this? We've actually worked with our Patient Family Advisory Council, and they've developed the formal definition. And it speaks to meaningful and true engagement with patients, families, and providers to really understand what it is that the patient is wanting, what their values are, and ensuring that they have the information that is going to position them to make the decision that's right for them. So it's true partnership in that sense. And they've developed the easy reminder of saying, respect me, hear me, and work with me. We've been in the process of working with the model redesign for about 2 years now, not quite 2 years, and there were lots of skeptics at the beginning. And the skeptics were actually in every discipline and every group of staff. And I think we had to appreciate that the skepticism came from was rooted in different things. It might have been fear around what was unfolding with the recovery plan. There was apathy in that, was anything going to change? Like, we've tried things before, they didn't change, or they didn't have the impact. So there might have been a lot of drivers behind that. And then there was a defensiveness on some levels as well, because to say we are going to become patient-centered suggests that we have not been, and anybody who's been working in healthcare for many years has always invested themselves in doing right by patients. It's more looking at how we do it. And so a large part of this was making sure that there were champions out there who were understanding and able to speak where they needed to, and in different meetings and different forums, and it was providing education. So with the education that we provided to staff to support the model the redesign of the care model, it included time very specifically on what patient-centered care meant. And increasingly, we have the patient experience advisors actually providing that education now. What we are really doing within this organization is all of us are changing in the way we focus our care and the way we partner as an interprofessional team and as we partner with patients. There are a number of measures that we are looking at. I think the strategic measure, the strategic milestone that we have right now is actually the number of patient experience advisors that we have on key planning and decision-making committees within the organization. So we want to know that we've got an adequate and robust representation from patient advisors and that they are actually involved in the planning and decision making. So that's one indicator. But there are other measures that we look at that if we are saying that we want to be improving the experience, there are different utilization indicators or satisfaction indicators that we use. We can look at safety measures such as the number of falls or the number of incidents. We do have the satisfaction measures by feedback to our patient relations program or through the formal NRC picker satisfaction surveys. We look at things such as length of stay. Are we doing better with working with families to plan the transition to wherever the patient is going to be going once they leave the acute care setting? So there are very objective utilization and business measures in addition to the satisfaction measures and the number of people that we have supporting the process. I guess I would say be unafraid and just start it. When we started the process with our Patient Family Advisory Council, it actually began without terms of reference and it began without a designed membership. It began by a few people in the hospital meeting with some patients who had declared that they wanted to work with us to make their experience different. And in most instances, those who were involved in the early stages were patients who had been really very dissatisfied and very disappointed with what the experience was and impressed upon us that we could and needed to do better. So they were willing to work with us. And then we moved into, well, how do we formalize this a little bit differently? But it was the patient experience advisors who actually helped with that design. So they were the architects of this, and we actually were the ones who enabled it and made sure that it connected back to the strategy. I think the one thing, the other advice would be, it's not just something that you do off the side of your desk, and it's not just another project. It has to be embedded into everything that is done every day throughout the organization. So it means that they need to be in every room where those hard decisions are being made. And it should be that there is always consideration of, will this be improved by having a patient help influence the design? I think measures will change. I think we appreciate we're still very much in the early stages of this, and we need to be very mindful that we don't get ahead of ourselves and that we don't take on things and then not deliver and not actually have the impact or change that we want to have. It's not just do it for the sake of engaging patients. There has to be that value to what they're doing. And so I think that we continue to engage them. We look at measures that we all know that we're successful and believe that we're successful if we do see them truly integrated into those groups or task force or committee that provide oversight to what we're doing and that planning. I'll be most persuaded that we're successful if we continue to recruit and retain our patient advisors. We have the formal measure in terms of the satisfaction surveys, but there's a lot of anecdotal feedback. But it can come two ways. I think one of the things is we're actually getting more patient concerns directed to us. We believe that's a good thing. It means that the patients and families are knowing that we want their feedback and we need their feedback to improve things. So the fact that they're using their voices and making that contact, we actually say that's great and that's going to help us and we will use that, and we need to demonstrate how we are using that. Anecdotally, we also get the feedback that people are seeing some of the changes that we're talking about. There are a number of our patient advisors who are actually current patients within the system. They may have chronic conditions that they come into the system on different bases, and they tell us that they see visit to visit there is evidence of the things that they are hearing about, that they're part of designing, and that they're seeing the improvements that they were wanting to see.